Hello, thank you for joining me. My name is Meghan Swenck, and I'm the lead author for this study, Physical Therapist Practice Patterns Utilizing Transcutaneous Tibial Nerve Stimulation for the Treatment of Overactive Bladder. I will be presenting this on behalf of my co-authors, Beth Shelley, MJ Strawhall, and Michelle Jernsletten. In the treatment of overactive bladder, there is a demand for treatments that are non-invasive, more tolerable than medications, inexpensive, and readily available. TTNS modulates the bladder by delivering retrograde electrical current to the parasympathetic nerves to the detrusor muscle, resulting in relaxation and decreased urgency. Our team had an interest in why TTNS seemed to be underutilized in our general clinical awareness for our own teams and friends that we had known who were also treating OAB at the time. We developed a survey. We were looking for descriptive statistics of the PTs treating overactive bladder. Who are the therapists treating TTNS? Who are not using TTNS? Where do these therapists practice? What type of practice settings? What kind of experience do they have? Why would someone not use TTNS? Why would they use TTNS? What parameters are they using? These are all questions we had. Therefore, we developed our survey. It was a 20-question online survey submitted via the Academy of Pelvic Health Physical Therapy, and we collected 178 surveys. The Academy of Pelvic Health Physical Therapy's 2023 clinical practice guidelines for the treatment of urgency urinary incontinence, urinary urgency, and/or urinary frequency in adult women cite TTNS with grade B evidence. Therefore, the purpose of this study was to identify current practice patterns for the use of TTNS by pelvic PTs in the US, as well as identify barriers to implementation of TTNS for the treatment of OAB identified by pelvic PTs in the United States. What we found is that very few physical therapists in the US are using this modality as a first-line treatment despite evidence that recommends it. We also found that levels of education and years of experience might influence this finding, and that therapists who are not familiar with the evidence or not comfortable with TTNS are statistically less likely to use it. For those using TTNS, parameters reported align with current literature recommendations. It does appear that there are some misconceptions or maybe some confusion about contraindications to the use of TENS. In fact, we found that for those therapists saying they did not use TTNS, the number one reason cited was contraindications, which was almost 78%. This may be surrounding issues such as metal implants, cardiac implanted devices, malignancy, and cognition, all of which are addressed in the full paper. What is the clinical significance of this study? Well, this study still poses the question, why are more pelvic health PTs not using TTNS? Our research team is hoping that this research will stimulate discussion in your clinics about utilization of this wonderful option. Based on the literature and our survey findings, we also want to challenge physical therapists to strongly consider the use of TTNS for their OAB patients. We'd like to challenge educators to include neuromodulation with TTNS into pelvic health curriculums, and we'd like to challenge professional medical organizations to publish practice guidelines, consensus lists, and support research to improve understanding and knowledge of the best practices and applications of TTNS. In conclusion, TTNS is non-invasive, more tolerable than medications, inexpensive, readily available, and based on this study, you guessed it, underutilized. Thank you for paying attention to our abstract video, and thank you to everyone who participated in our survey. We truly appreciate it.